Hi everybody, Quinn Miller here from Employee Benefits Asia, part of the Tenzing Pacific Services group of companies. Today we're going to be talking about your health insurance benefits, specifically what benefits are available and what's recommended. So after living here and running Tenzing for over 10 years, what I realize is, a lot of people come here to Vietnam or to Southeast Asia, and they're from a country with a national healthcare system. So things like private health insurance and all of the terminology is quite new to them. So that's what this video is designed to help explain. So first of all, with your insurance, there are two benefits that are mandatory. Those are your inpatient and evacuation. Evacuation is almost always bundled with inpatient. So inpatient, to further explain that's staying in the hospital overnight for more serious things. Those are things like hospitalization, your private room, surgeries, things like your surgeon's fees, and all of those other things that add up if you were to stay overnight in a hospital. So that's your mandatory benefit. Think about that as things that happen less frequently, but they would cost a lot of money should you, wind up in a hospital, especially if it's an extended stay. Your next benefit is your outpatient section. So those are going to be your routine doctor visits, things for minor injuries, minor illnesses, where you go to a hospital, you go to a clinic, you see a doctor, you maybe see a specialist, you get some treatments, you get some medication, and you're on your way home. That is outpatient. Usually with outpatient, there's an annual health check as well. Other benefits that are included in outpatient might be things like chiropractor, physiotherapy, alternative medicine, outpatient psychiatric, vaccinations, your test medications, and then again, your consultation fees. So that's the outpatient section. The next section of benefits is going to be your routine dental benefits. So those are going to be things like your minor dental, which is going to see checkups, cleaning, polishing, scraping, sealants, minor dental work. Then you have a major dental benefit, which usually has a 9 or 10 month waiting period. That's for more proper dental work. And then your last section is going to be your maternity benefits. So with maternity, that's going to be things like your prenatal visits, routine delivery, complications, and newborn cover. So when you think about it as a whole, there's sort of 4 sections of benefits. One, your inpatient, that's the mandatory. And then you have your optional benefits, which are outpatient, dental, and maternity. And then if you want, you could also add a life insurance policy, which would run concurrently or parallel with your health insurance, which would be taken out by a separate provider. So if you're looking for some health insurance today and you want to compare your options, get in touch with me. My contact details are in the bio or provided in the link to this video. What I can do is either put together a range of quotes to compare everything, or if you specifically know, hey, I'm just looking for inpatient or inpatient and outpatient, just tell me and I'll put together a video. Here I am out on one of my favorite trails, just out cycling here before it gets too hot. If you're ever in Hoi An, look me up. I can hook you up with some good cycling trails. So thanks again, guys. Have a good one. Quinn Miller here from Employee Benefits Asia.